Schritt. Prima. Und Schritt. Ja. Und Schritt. Gut. Und Schritt.
Now bring your weight towards me and move the right foot forward. Bend the right knee to help you stay.
Thank you for your interest in the Arjo walker, the versatile aid for safer ambulation training. In this video, you will see physiotherapists from the United Kingdom and Switzerland who have many years' experience in using the Arjo walker. We begin in the United Kingdom, at the Elderly Care Unit of Southampton University Hospital. And meet Superintendent Physiotherapist Sally Ann Adams. Sally Ann has been using the Arjo walker for the rehabilitation and mobilisation of her patients since 1987.
Since the introduction of the European Community Directives on Moving and Handling in 1993, physiotherapists in Europe have become much more aware of risk assessment when working with patients. Now, the standard physiotherapy assessment has always involved an assessment of risk, both that to the therapist and to the patient, but this has become much more formalised. Alongside with this has become an awareness of unacceptable risk and the time when we need to turn to pieces of equipment to help us in our treatment of the patients, to make it safer both for us and for the patient. And this is where the Arjo lift walker has become invaluable. Although I'd already used it for several years before these directives became enforced, my colleagues have become more and more aware of its value. I'm working with people who haven't used one before and who are now beginning to use it more and more. When the risk becomes unacceptable, or the patient is unpredictable, or too heavy or difficult to manage safely, then it is important to be able to identify the equipment which will reduce the risk and provide a safe environment both for patient and therapist. And this is where the Arjo lift walker has become invaluable. With the use of the safety straps, no patient can fall with the Arjo lift walker. If they decide to take both feet off the floor at the same time, as has been known, the straps will fully support them. They cannot hurt their shoulders, even if they remain in contact with the handles and grip them firmly, as the Arjo can be lowered to such a level as to control them. Also, it can be raised so the patient can be effectively hoisted into a nearby chair. During this time, the patient isn't injured and neither is a member of staff hurt by trying to save them. The use of the Arjo lift walker often reduces the number of members of staff required for a safe treatment session, as well as providing the patient with a safe environment so that they are more confident, and this results in increased motivation and improved performance. Using the Arjo lift walker for walking can either be therapist-led or patient-led. If the therapist needs to steer and move the lift walker, this can be done from in front or from behind. The patient, however, if capable, can steer the lift walker themselves and gain a sense of freedom manoeuvring down the ward. The rear wheels can be locked to allow for stability, and the brakes can be used to keep it secure for the standing up and sitting down. Patients who have forgotten how to walk or how to align their body segments in a safe position for standing and walking are often facilitated by the movement of the Arjo, will follow it safely, producing a reciprocal gait pattern, and a more normal gait very quickly returns. In this way, the Arjo lift walker can be used as a temporary piece of equipment to facilitate a more normal movement, and the patient then progresses on to something else, such as a gutter frame, a delta rollator or a wheeled Zimmer frame. This is Joan. Joan was admitted to the hospital nearly 2 months ago, and a month ago was transferred from rheumatology to the rehabilitation wards on the elderly care unit, because we have the Arjo lift walker, which rheumatology didn't have access to. And without this piece of equipment, we wouldn't have been able to work with Joan to the level we have been able to. We're going to show you some footage of Joan using the Arjo lift walker, and we've also set it up so that you can see how we progressed with Joan and how she started initially to what she is achieving now. Because of using the lift walker, we were able to stand with Joan much earlier than we would otherwise have been able to manage. Joan was able to feel safe and secure, and we knew we weren't going to harm her. It made it much easier for us. With the current EC directives of risk assessment, we knew we were safe and we knew that Joan was safe. We were able to practice standing work and balance and using the mirror in front so that Joan could use her own feedback. We were able to progress to individual knee control and hip control activities and then stepping. Joan has improved her sitting to standing ability and uses the frame less. She also requires fewer of the straps that we used to use originally. And this week, for the first time, captured on video, she has been able to walk a few steps across the room using the Arjo lift walker. Using conventional frames or standing to a high-low bed, we wouldn't have been able to progress, we wouldn't have been able to do the things that we've done with the safety and security of the straps.
Pick that right foot up, step it.
George was admitted to hospital 3 months ago after a cerebrovascular accident leading to a right hemiplegia. After a month of working for transfers and standing balance and some return of postural tone, particularly in his lower limb, which was very flaccid, George was able to progress to using the Arjo lift walker, with which he began to walk. He never needed a lot of straps or support, just the safety belt at the back. It gave him confidence and stability. Without side bars, the therapists were able to access his leg and work for hip, knee and ankle control and weight transference. The activity of sitting to standing with the Arjo lift walker encourages and reinforces the normal movement patterns of flexion at the hips and trunk in preparation for standing and allow the patient to come up into extension. There would be some concern at the use of handles, but although George has to hold the handle with his unaffected hand, he does not pull himself up on this handle. There is no overuse of the unaffected side. There is reinforcement of a bilateral weight bearing and bilateral activity, so there are no associated reactions or increased tone or abnormal movements. This allows the patient to relearn the movements required in a safe environment and then to progress on to walking as he would normally. When George is walking down the ward, it's possible to lock the back wheels so that the Arjo is easily steered from the front and is safe to manoeuvre and walk. When wanting to turn round or manoeuvre in a small space, such as backing to the chair by the bed, the back wheels can be unlocked. This makes the lift walker very manoeuvrable and very easy to turn the patient and sit down again safely. George progressed after a month onto walking with one walking aid in his unaffected hand and no longer needs the Arjo lift walker, but he still remembers it as a very valuable piece of equipment in his way onto his present level of mobility.
There we go.
Okay, thank you, George.
Yeah, I'll take 2, please.
Although George didn't need to use the tilt table during his treatment programme, he kindly agreed to help us demonstrate how the 2 pieces of equipment could be used together. I found that with some patients, even the forward flexion required to reach the Arjo's handles is too much, and it isn't possible to bring them into a standing position using the Arjo lift walker. With these patients, putting them onto the tilt table, bringing them up to vertical, and then placing the Arjo lift walker in front at an appropriate height, again gives them safety and confidence in standing in that position. The straps, first of all at the knees and then the trunk, can be removed, assessing as we go as to the patient's stability and their ability to reach for the handles and transfer their weight onto their feet and onto the Arjo. Once all the straps have been removed and the patient is safely using the Arjo lift walker, safety straps can be applied if required and the patient can then walk away from the tilt table. I have found this most useful with very stiff Parkinsonian patients who lack flexion but who once up can begin to walk again. The required flexion movement to sit down then reinforces the normal movement pattern, and some of these patients can then stand up the next time using the Arjo without needing to use the tilt table again. It's also been useful with some stroke patients who were unable to stand initially and who were really struggling to take weight through their feet. The safety of the tilt table combined with the Arjo gives them the confidence to take their weight and then progress onwards.
In the town of Solothurn in Switzerland, we visit the Bürgerspital, a 400-bed general hospital which has a large physiotherapy department with 25 physiotherapists. Mr. Koik has many years' experience in working with the Arjo walker. Mr. Koik, could you show us some examples of how you use the Arjo walker in the ambulation training of your patients?
Ja, dat is goed mogelijk. Ja, onze eerste patiënt wird een patiënt van
Yes,
de
of
orthopedische
course.
kliniek zijn.
Our first patient is someone from the orthopedic ward who has been given a total hip prosthesis. With these patients, we usually take the walker to the bed and do the first mobilization there, when the patient has recently been operated on and still has considerable problems with stability. So the patient can hold on firmly and be protected all round by the walker.
Goed kan vasthouden, dass er rundum geschützt ist durch de Arjo. Und wenn wir dann aufgestanden sind und der Patient sich
When
gut
we then
fühlt,
stand the patient up, he feels good and the first attempts at walking are made.
nach die
Corrections are then, of course, made after the walking attempts.
Korrektionen aangebracht. Ja, dass man versucht, eine normale Bewegung aus dem Bein zu kriegen. Und anschließend kann man
One tries to achieve normal movement of the legs and then free exercises can be tried. We're able to begin the exercises with our patients as early as 5 days after the operation, with, of course, close supervision by myself.
Mit Instruktion von mir aus. Unser zweiter Patient ist ein Patient von der Chirurgie. Ja, und inzwischen
Our
ist der
second patient is a surgical patient. He has recently been transferred for rehabilitation in order to undertake very intensive training. Using him as an example, we will show you how we began in the initial phase. The patient is an amputee and has had an amputation at the knee and is still waiting for his prosthesis. We at the physiotherapy department want to begin with walking training right away. In the first phase, the seat is used which can be attached to the walker. The patient sits on this and feels secure and cannot fall down due to his missing leg. Here too he has good support from the arms. He will then be raised to a standing position, do the first stabilization exercises and also walking training in the same position. When the patient then feels more confident and is on his leg, still on the one leg, we can then continue with the training without the seat.
Dan kunnen we ohne de zits onze training weiterführen. Und dann hebben we de Arjo eigenlijk meer zum Brauch van correctionen machen. Ja. We willen bewegungen in het
In
bein
this phase, the walker is needed more for correction purposes, and we want to get movement into the leg. We want to introduce movement of the stump, which is important for the use of the prosthesis. Apart from walking, there are also exercises such as stretching exercises, as the patient is, after all, going to be sitting in a wheelchair all day, and it is very important that he sits upright so that he can make full use of his stump.
Ja. Andere voordeel is nog.
A further advantage is that the walker can withstand a great deal of weight. I don't think that any other aid can support a patient weighing 100 kilos with such stability.
Zo stabiel kunt aufstellen. Onze dritte patiënt is een patiënt aus de laatste discipline van het hospitaal, aus een medizinische
Our
teil.
third patient comes from the last discipline in the hospital, from the Department of Medicine. The patient has had a brain hemorrhage, and he is now undergoing rehabilitation. He really needs the walker very much as a training aid. Not for walking, but more for standing, where good support for the arms in the flex position is maintained, or, specific to the neurological way of thinking, in the support position.
Het ganze specifische neurologische denken in de stutspositions. Gleichzeitig
At
brauchen
the
wir
same
dann
time, yet more aids are needed, such as splints.
splints.
Here, the walker gives plenty of room to apply the splints.
Abzustellen.
The walker is not just needed in the forward position, but also the other way round. It provides so much stability that one can even play a game of football.
Es gibt dan zoveel stabiliteit dat we daar sogar een voetbalmatch kunnen maken.
At the University Hospital in Bern, the Inselspital, we meet physiotherapist Mr. Heron, who works in the neurophysiological rehabilitation ward.
Der Patient, der da sieht, der hat vor noch nicht allzu langer Zeit aufgrund von einem Autounfall ein Schädel-Hirntrauma erlitten.
The patient you see here had a car accident not very long ago and suffered skull and brain damage. As an additional problem resulting from this accident, he suffered a forearm fracture on the left side. He also has a right hemi syndrome. We are doing walking training with him using the walker as he has a partial load of 15 kilos prescribed.
Weil der Patient hat eine Teilbelastung von 15 Kilo verordnet. Und
this walking trainer is in fact the only apparatus which we can use for this patient, as he must not put stress on the forearm because of the fracture. By supporting himself using his elbows, he is able to produce a partial load of 15 kilos.
Ist in der Lage, eine Teilbelastung von 15 Kilo herzubringen. Weiter einsetzen wir das Gerät häufig einsetzen bei Patienten,
We also frequently use the apparatus with patients who have pain which diminishes by relieving the strain. It is especially valuable for patients with herniated discs who have just been operated on, where the walking trainer is particularly useful, as the patient can support himself and thus walk free of pain. Furthermore, we can use the walking trainer for patients with deep or superficial sensory problems. Often they have the problem of severe difficulties with balance when walking, and thanks to the fact that they can stabilize themselves on the apparatus, walking really does become possible.
Innere strekken, 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 strekken.
George, doing very well. You all right?
Yes, yeah.
Right, walk towards the
Don't know
chair.
myself.
You are, aren't you?
Walk towards the chair and then we're going to turn round. Similar pieces of equipment on the market do not have the manoeuvrability or the up and down facility of the Arjo lift walker and often have side bars, which mean it is not possible to access the patient safely to work on hip, knee, ankle and foot activity. Although the Arjo lift walker is an invaluable piece of equipment in the gym or treatment area, it is also easily used on the ward. Patients begin by their bed or on the bed or in a chair and begin to progress down the ward. The nurses very quickly begin to recognise how useful this equipment is and regularly ask if it can be loaned for the weekend when the physiotherapists are not on site. The Arjo lift walker has been useful with patients with dementia and confusional states, for those with Parkinson's disease and Parkinsonian symptoms, for stroke patients, patients with osteoarthrosis, spinal cord injuries, not complete injuries, and for those with hip and pelvis fractures. It is a general tool for aiding in mobilisation, but as with all pieces of equipment, a thorough assessment of the patient's abilities and the risks involved should be taken. It is very appropriate for many patients, but obviously not for all.
Good. Well done. Bring your weight towards me. And step with the right. The right knee to help you. Good.
Well done, Joe.
Well done. First steps. That's on camera. Prove it.
That's right. Excuse me, Joe.
All right there. Keep your tummy forwards.
Take your hand. Take it down, but we'll loosen it.
on your forwards. Right, when you are. Okay. Stick your bottom out then. Bend. Stick your bottom out. Bend, bend, bend. See if I can. That's lovely. Good. Okay. Well done, Jo. Wow. You took a few steps. Yeah. There you are. That's the best she's done. Well done, Jo.
We hope that this video has given you ideas on how the Arjo walker could be useful in the ambulation training of your patients. Right now you can borrow an Arjo walker for trial, free of charge, for 2 weeks. It comes ready assembled with operating instructions and a supporting in-service video, so you can start trying it with your patients right away. Just fill in the enclosed card and mail or fax it to us.